Dumelang ka lapeng. Welcome to Come Alive with Mpho Mokgotsi, the show that inspires you to live your best life. I am Mpho Mokgotsi. I am a life coach, energy healer, award-winning author, and philanthropist. Today we are discussing cancer, the effect it has on the body, the mind, and the spirit. With me today, I have my beautiful, gorgeous sister. She's going to be telling us her journey about cancer, and her name is Naniki. Naniki, welcome.
Hello, Mpho. Thank you so much for inviting me.
Please introduce yourself.
Well, I am Naniki Siboni. I am a cancer survivor, and I'm a cancer awareness facilitator and speaker.
Oh, that is amazing. So I've heard you speak before about your journey with cancer, and obviously the viewers haven't heard that. And I want you to please share your journey with them. Tell them, where did it all start? What happened?
Well, I think with any journey in life, it can be a long one or a short one, but I want to make it brief for your audience. So mine is a 20-year-long journey. It started when I was 5 years old. I started having signs and symptoms of cancer, but we didn't know what they were at the time, so I just kept moving. So the signs that I was seeing is that I had multiple and severe nosebleeds, I had severe sunburns, and I just wasn't a happy child in the sun.
Aww.
So we just thought, it's this little light-skinned girl, a Muswe woman. But it just kept evolving. When I was 7, I developed my first mole, which I call the jelly tot mole. So it looked like a jelly tot, just gray in color. So the thing about this mole is that it was perfectly round, and it was gray in color, and it was almost the size of the back of an eraser. You know, on the pencil?
Yes.
The back of that.
Wow.
So obviously it was concerning for my parents and everybody in the house, and you know how children can be. They used to tease me about it. I know unsompa. Oh goodness, 7-year-old little me. So this mole had to be removed. It was uncomfortable, and my mother and my uncle decided, no, we're going to do a home removal. Suffocate.
Yeah. And how often do we do that as Black people?
All the time.
All the time.
All the time. Don't do it. Right? So eventually it fell off.
Yeah.
And then it grew back.
The same place?
Same place.
Wow.
Same thing. Grew back again. We did the same
the
procedure.
Second procedure now
100%.
to remove it.
Exactly. And then it was gone, and we thought we are done with this.
Yeah.
Now move on with your life, baby girl.
Okay.
But the thing is, the effects of what was happening to my body had already, started to take place. And here I was, this young athlete. I was a swimmer, a runner, netball, athletics, all these amazing things, being an active child. But because I was so exposed to the sun, there was some DNA damage that was being formed.
Oh my word.
And this is the issue now with the type of cancer that then I was diagnosed with. So life continues. I'm now in my 20s, and a new mole develops.
Different place this time.
Different place. So that one was on the left side of my hand, and then this one was on the left side of my leg. So I'm staying on the one side of my body. What weird moles are these, So this mole now develops, and it's very different to the first one. This one is black. This one is irregular in color, in shape as well. So it's black, irregular, its border is strange. It's concerning. But to who?
To you.
Not to me. I'm hiding it.
Oh, you're hiding it
because it's so painful.
Yeah.
So in varsity at the time, my white lecturers are saying, you need to get that thing checked out.
Because they could already see that this is strange.
Something strange here.
How they're like, we're cool. Yes.
Plus nobody sees it.
I can really do a beauty spot.
Beauty spot, but it's not. This was a dangerous, cancerous mole. So eventually, I go into the hospital, they do a biopsy, and it comes back as a stage 3 malignant melanoma diagnosis. But, what does that mean? And they said, you have skin cancer.
Oh my word.
And I thought, this is strange. I'm a black person.
And we never hear of Black people having skin cancer.
Not us, which then made sense why my white lecturers were always so concerned. Light bulb moments everywhere. And it was something that had to be addressed immediately. But it took me 6 months still. Because of my own personal fears and depressions and anxieties about dealing with a cancer diagnosis at the age of 24, 25 at the time. And
Prime life right there.
absolutely. What I was pursuing at the time, I thought would just run away from me, because how do I pursue radio and be this amazing broadcaster when now I've been told that
When you
I
have
have
to now
cancer?
deal with cancer at the
you
same
know?
time.
Exactly that. So eventually I did have to suck it up. I prayed about it. God answered me and said, you need to go in. I went in. I remember very specifically, it was a Monday.
So you had to go in for a procedure.
Yes, I did. Absolutely so. I went in on the Monday, told the doctors I'm here. They said, we're admitting you the next day. On the Wednesday, I went in for my surgery. Friday, I discharged myself. So it took literally a week.
So you discharged yourself.
Yep.
Why exactly did you do that?
In the 6 months that I had run away from the hospital, I was dealing with one of the biggest mental episodes of my life. I was having depressive episodes and I just wasn't dealing well. So I didn't have the mental strength or capacity to deal with the diagnosis like that. So I knew that if I'm going to be in the hospital surrounded by sick people, all that's going to do, I'm just going to keep absorbing. So I needed to make a choice to save myself. And I said to the doctors, you did what you needed to do. Now I have to do what I need to do. It was not advised, but it was a decision that I had to make in the moment in order to save my life and my mental health.
Oh, that is incredible. Your story is one that truly touches my heart because, like you said, as Black people, you never ever think that you'll get skin cancer. We know there's different kinds of cancers, breast cancer, ovarian cancer, and all these things, but never do you ever think that you'll get skin cancer because oftentimes we are told, oh, your melanin will take care of you,
All
girl.
the melanin in the world.
Exactly.
Right. And the thing about it is, it is true. The melanin does help and protect our skin, and that's the thing that gives us the color, right? But as I said even earlier, that there's damage that gets caused when you're, exposed to the ultraviolet. So in terms of the sun or tanning
And not using sunscreen lotion,
exactly,
I
or
suppose.
protecting yourself in seeking shade or wearing sun protective clothing, is that the DNA gets damaged. And when those normal skin cells that are supposed to develop to grow and to keep your skin as it is, what they do when they're damaged by the ultraviolet is that they over multiply.
Wow.
And that's what causes the moles and then the cancer, because cancer is a multiplication of all these cells that shouldn't be growing in that speed or in that way. So that's where we find ourselves now, even as Black people now, that more and more people of color are being diagnosed with a skin cancer. It may not be something that you see on your skin. It can be seen in hidden places. If you take Bob Marley, for instance, he had melanoma similar to mine, but it was found under his nail. So this is where now Rona batho ba ko gae need to look and on our palms, under our feet, in between our nails, to make sure that we are careful and we take care of our skins, because melanoma can be found anywhere. Top of your heads, bokae ba rata go kuta, tshasa or aparakati.
Oh, that is incredible. Naniki, thank you so much for sharing this very important and crucial information with us, because I think a lot of us, we don't necessarily know that we are actually privy to getting skin cancer. So if I suspect that, Barakidi beauty spot in Mpho, I've got lots of them because I've seen lots of people actually have that.
Yes.
Would you say somebody needs to actually go and have that checked out?
What you need to always look out for is if it's a new one that's just developed, or if it's one that has already been there but is now changing in shape, in color, in diameter, in how it feels. When you start to notice those kind of things, definitely go get it checked out. But once you get to, we have the beauty spots or sometimes skin tags. Get those checked out. Don't be ignorant and sit at home and say
Absolutely. Thank you so much. Your story is really incredible, and I'm quite glad that you've shared it with us. It's opened our eyes, and thank you for coming through.
Thank you.
And right now with us, we've got Tammy, who's also going to be sharing his journey with regards to cancer. Welcome, Tammy. Please introduce yourself.
Igama uThami Washabalala from Soweto.
Okay, nice to meet you, Butwa. Yebo. So, tell us about this cancer that you've had. What kind is it?
It's called Hodgkin's lymphoma.
Yebo.
It's a type of cancer that affects your lymphatic system.
Wow.
So your lymphatic system works hand in hand with
Oh my gosh.
immune system. So what it does, it multiplies our white blood cells. So if you don't get it checked out and get treatment as it progresses, then your body will have trouble fighting infections.
Oh my goodness. I know that lymphatic drainage is very important because that's how we get toxins out of our body,
Yes.
right? So to have that kind of cancer, how did you actually discover it to start with?
Look, when I got symptoms, I was a little bit bigger than this. So I lost weight. So to me, it was finally the weight is gone.
Wow.
So I had night sweats. So not just any sweats. You know, when you're sleeping, 2 hours, you change, you move position from one side to another. Where corner, when you move, you can actually see the machines, they are wet. So it was drenching night sweats. So night sweats, I had lymph nodes underneath the armpits, but now because they were not painful, to me, okay, it's not painful, so it's fine.
Oh my
It's all
goodness.
born. you
Yeah.
know. So yeah, when it progresses, then you get itchy skin, that your whole body starts to itch.
So you start to scratch all over?
Yeah, we start to scratch all over. Then I had a persistent cough that couldn't go away. That's where I decided, you know what, now let me go to the doctor after self-medication. You know, as men,
Especially
self-medication.
men. I know you guys
Yeah.
don't even like to go to the
The
doctor.
self-medication, yeah, no. Even now, I still don't like going to the doctor. You know, so went to the doctor. The doctor suggested doing X-ray, chest
Yeah.
X-ray. When I came back with the
Was he
results to him,
suspecting maybe TB at the time?
so there was some rumbling sound that he did not
Okay.
understand. So that's why he said to me, I must go and do X-ray. So when I came back with the results, bese ngivavulile phela, you know, packed on the side, open up, have a rate, ngafunda laphayana. At some point, I see they're suspecting a lymphoma. Google, you know, driving back to the doctor, I was a little bit depressed because now I could have cancer. But, you know, let's get confirmation from the doctor because I don't know these terminologies and whatnot. So when I went to him, he said to me, listen here, Baba, we are sebenza. I said, yes. He said to me, Monday, you're going straight to a Para. He wrote a referral letter. Then on Monday, I went to Para, stayed there for the whole day. When I saw the doctor there, the first thing that he said to me, your chest is a mess.
Oh my word.
Because when they look at the X-ray, I think they couldn't see where the heart is and where the lungs. There was mess all over the chest cavity.
So it sounds like you actually just came on time.
Yeah, no, I came on time. I came on time because after that, they sent me to do a whole bunch of tests. I did FNA, where they take a needle, a long needle, and on the lumps that were underneath my armpit. So they take a sample. They did a biopsy. So they had to take a piece of skin. And they did a bone marrow test. So they had to go to the bone, take a sample as well to confirm.
These are extensive tests that were done on
Yeah,
you.
and I did everything like para. Yeah.
So, Butwam, especially as a man, right? Because, I mean, we women, we are very much, I'd say, in touch with our emotions.
Yes.
And we can, you know, cry and have people come and comfort us. You going through this really difficult time in your life, how did you handle the emotions that come with something like this?
You know what, surprisingly, being too emotional, I was like, okay,
It
it's
is what
this.
it is.
It's either I take treatment and there might be a chance I will survive, or I don't take treatment, then chances are it will take me. So I decided, you know what, let me take treatment and see. 5 years later, I'm still here, but now it came back, so I'm still on treatment again.
Oh, my word.
Yeah.
Do you have a family? And at the time that you are going through this process, did you feel like you had a support system that would aid
No.
you?
The support system, bacon, yeah.
Okay, that's great.
Family and bacon.
Bacon,
Mom, dad,
holding your
sister.
hand through it all.
Yeah, no. Bengekho one. I had people, but now you see, my dad is like me.
Yeah.
But he was there.
Okay.
Yeah.
Financial strain on something of this nature. Because I can imagine how many times you had to go into hospital, so we spoke about the emotional element, but the financial side of it, how did that affect you specifically?
Look, luckily, I did everything, and I'm still doing the treatment at a public hospital.
Yeah.
We pay, but we don't pay as much as the private hospital. Because if I did go to private hospital, the current medical aid base over exhausted.
Yeah.
So I still take my treatment at Para, look, I'm getting one of the best treatment at Para as we speak.
Yeah.
Because now the treatment that I get, I have to get chemo and stay in hospital. Your blood count will drop. Then masses kupuka, then get discharged. So that takes about plus minus 2 weeks.
Oh, wow.
So I'm going for my 5th cycle. So all those 4 cycles I had to stay at Para.
Okay.
So it's not that financial draining in the pocket.
Oh, that's amazing. I'm glad to hear that.
Yeah.
What I want to also know from you is, for example, you mentioned that it came back again.
Yeah.
Right?
Yes.
So how did you discover that it came back? Or is it something that you religiously have to check on yourself?
Look.
Explain to us, please.
Okay, how it works is Gucci, after the chemo and they will tell you Gucci, now you're in remission, but there's constant
monitoring that's happening.
Monitoring, yes. So you have to go for your checkup. So first it will be every month, after every month, every 3 months, every 6 months. If you like it, then every year. But every time you go for your checkups. So when I went for my checkups, so we discovered Duguti, there's lymph nodes now on my neck. Then the weight loss again.
Yeah. So that was the second discovery.
That was a second discovery.
Wow. Thank you so much, Tammy, for sharing your experience with us.
Yes,
we are much better, informed in terms of this kind of cancer because personally, I never even knew that it existed.
Look, there's many types of cancers. Some of them I do not know.
Okay.
So all those prostate,
yeah.
They talk about it, but some.
But not this one specifically.
Not this one specifically, because even me, I only knew it my saying pet.
Okay.
So it's always advisable, Luguti, we go for checkups, yearly checkups. There's no use of paying medical aid. They say we are a banker for
Absolutely.
So let's use these medical aids for checkups.
Tammy, thank you so much for sharing your story with us. Yes. We are much better informed in terms of this type of cancer because of you. Thank you, Budwam. Right now, I have both Tammy as well as Naniki to further clarify for us this journey regarding cancer. Naniki, let's start with you. So you found out this cancer situation, you went through a whole lot. How can we support you? I'm talking about as the people that have never really been in that situation, because I feel like support system is so crucial. It's so important for you to be able to get to your healthy self. How can we support you further?
I think with anything, whether you're going through an illness or just life in general, is that everybody reacts differently to things. So what I would say to people is ask the person, what do they need?
Yeah.
Because you find yourself in a space where you want to be a present feature in somebody's life, but what they need is space. So communicate with people, especially if they do tell you, look, I'm going through something like this. Ask them, what do you need from
me specifically?
And then take that, and that's how you support them. Because you don't want to be a nuisance while somebody is going through something so life-changing. So rather respect what a patient is going through.
Absolutely. Tammy, would you like to share from your point of view how we can support you as a community, perhaps, maybe?
Look, Naniki has said it, but just be there. but don't be too much. Because sometimes you'll find people, sometimes one needs space, to gather your thoughts and, just reflect on things. So just be there. But if I say to you, you know what, hey, today I feel like to be alone, respect that and let me be alone.
Yeah. And to you again, normally, you'll find in our communities, especially in the Black communities, where if you have any kind of ailment, we will be saying, don't go first up to the doctor, and then see what happens. So with regards to that, somebody who's actually, they first call of, I have something happening in my body, the first thing I do, what advice do you give that person?
Hey, wakhuluma ngesipade. When growing up, wakhwehlela kayi-one nje ugogo sekakubhekile spade. Look, yes, we have our home remedies that we do, but remember, we are not trained as doctors.
Yeah.
Our parents are not trained as doctors. Our grandmothers and granddads are not trained as doctors. Yeah, good dokotela, the person who's trained to know these symptoms. Angeke kube one remedy for everything. Ayisebenzi kanjalo.
Absolutely.
So angeke uspade for i-flu, spade for isisu, ispade for ikhanda, angeke isebenzi.
Makhona tsotlhe.
Hayi, awunamakhono tsotlhe. So just go to your doctor, then take it from there. Kudokotela. That's my advice.
Absolutely. I'm just getting a sense that, over and above the normal checkups that we do, because I normally would do your discovery checkups, right? But I don't think there's a cancer checkup on that list. So if I wanted to just go and have a look for myself, where can I go?
The most common ones, like your breast cancer, your testicular cancer, that one you can do your self-examination after you shower, then you check yourself.
You can check if there's a lump there that wasn't there earlier.
Yes.
Okay.
So those, you can do them every now and then. As soon as you notice, now there's something right. Last week, my breasts were like this. This week, or my testicle was like this. This week, then that's where maybe there's trouble. Go for your checkups. Because we have this thing which I know is right. By the time you go to the doctor, it's too late.
So tell us a little bit about what really happens to you when you go for chemo.
Oh, look, as soon as you tell people I'm going for a chemo, then now they will tell you what they had or their experience with what, hey, I lost all my hair, and all that. And what I found out, look, there's different reaction. Everybody has their own, When I did my chemo the first time, I did not lose my hair. I had my hair throughout.
Wow.
I got sick. I had boils there and there. But I used to get chemo on Tuesdays, Wednesday, and some 17. And nobody would notice I got chemo yesterday.
Yeah.
At some point, there's a lady I'm 17, and she said to me, when are you always, probably if you knew what I was going through, then I told her, look, I'm going for chemo, this is what's happening, and she was shocked.
Wow.
I'm getting chemo now. The first time when I got chemo, I got sick. I got diarrhea, nausea, I was dizzy. That's the first cycle that I got. The second cycle, nothing happened. I was okay.
So I get the sense that, it's different for everyone.
It's different for everyone, yes.
Yeah, okay, great stuff. Thank you so much, Naniki, for sharing your heartfelt, experience when it comes to this very difficult subject that we are all faced with. I don't know one person in this whole world who's not affected or infected by cancer.
Yeah.
Thank you again as well, Tammy, for sharing,
Sibongela.
especially from a man point of view, because
Yes.
we need more men to come out and actually talk about their experience about, these pertinent issues that we are going through as a nation. You've heard it from the lovely guest that I had in studio right now about what cancer has done for them and what they have gone through in terms of just overcoming this disease that we call cancer. It may not necessarily have gone completely, but again, I urge you at home, if you are feeling some kind of way, you heard Naniki say, you know yourself better. If there's something in you that is troubling you, don't just sit home and think that home remedies are going to sort you out. Seek out help as quickly and effectively as possible, because your life may be depending on that. Thank you so much for joining us, and we will see you again on the next episode of Come Alive with Mpomokotsi as we talk about amazing conversations that needs to be had. See you next week. Cheers.